Hi everyone, welcome to Facebook Live. We are not doing a Midwife Monday today because it is actually Friday. This past Monday we were catching a baby, so we had to postpone our Midwife Monday. And the prior Monday, I was recasted. Still have broken bones over here, which is kind of a drag, but I have good movement in my fingers. So today we're talking about pregnancy fitness, postpartum fitness, and we have the lovely Nicki Herrera, who teaches, she's a birth fit coach. So some of you have heard about birth fit, so she's a birth fit coach. She works up here in Santa Clarita, and works out of the training club here, which is a private gym here in Santa Clarita. And your company name, your business name is
Babe Fit.
Babe Fit. And so we're going to talk about the importance of pregnancy fitness and postpartum fitness and how they all go together. You know, we talk a lot about when is the right time to start with a midwife, right? And we say, well, the sooner you start with a midwife, the better. You get all the benefits throughout your pregnancy. It's far better to start with a midwife at, 8, 10 weeks pregnant than it is to start with a midwife at 37 weeks pregnant, because we want that length of time to really create relationship, work together, know who you are, know what works for your body. And Nicki's saying it's the same with your fitness, right?
Absolutely. So the sooner that you can create the connection, just like Renee was saying, it's a lot easier to work outside of compensation. So what we mean by that is saying, early on we can set up the standard for the mindset piece. We can set a purpose behind the training that we're doing. And just like each mama is different.
Right. So when you say without compensation, that means before there's an injury or before there's a problem to solve.
Right.
So before you're pregnant, you're thinking about getting pregnant. You want to work, you want to get your body into a healthy place. You realize you're pregnant and you're not maybe where you want it to be, or you just want to continue to stay fit. And there's lots of different ways you can do that, and lots of different degrees. So it doesn't mean you have to be like this, super ripped, muscle person. You can be softer than some others, right?
Absolutely.
So, but talking about getting started right from the beginning so you can maintain a healthy body. Right? And we're not talking about weight. We're not talking about the number on a scale. That's really important.
Absolutely.
Okay? So we very much don't believe that the number on the scale means something. So some people have a higher BMI than others. We want to always just make sure that the body is working at your optimal level. Is that right?
Absolutely. You will never, ever, ever see me with a pre or post client weighing them. It's not my concern. My concern is, how are they feeling? What's their nutrition looking like? How are they nourishing their body? How is their body moving? What's going on mindset wise? What's going on in, what does their day-to-day look like?
Right.
What are they putting into their body? How are they moving their body?
And how do you see that helps them through, because you specialize in pregnancy and postpartum.
Right.
So when you start with someone in the beginning, tell me what are you looking for, and what are the goals? What are you hoping to achieve with these people?
That's such a good question. So because I have multiple levels of women, some of my women have been training with me 5-6 years. So before they've even conceived or thought about to conceive. A lot of women come to me from other gyms, or come to me just maybe they've never even worked out before. So it starts out with setting an intention, sitting down. What are you trying to achieve here? Obviously, healthness, nutrition, fitness. But what does that look like? What's your current life look like?
Right.
So I'm not trying to have somebody come in and train with me that maybe their regimen is light yoga and walking once or twice a week, and coming in and thinking that I'm going to set them up on a barbell and having them run miles and things like that. No, it has to be realistic. It has to make sense. It has to really fit into their lifestyle too. So I want to know: are you a working mom? Are you a stay-at-home mom? How many other kids do you have? What time do you go to bed? What kind of hours do you work? What's life like? What's life like day to day? And then how do I meet you there? How do we figure out what that looks like, what your version of healthy looks like, and how to implement that.
And then do you work with them with their nutrition?
Absolutely, yeah. So that's a really big piece of what we believe as birth fit coaches is there's pillars within our training. So with the mindset piece, the fitness piece, the nutrition, and we believe in being healthily adjusted. So chiropractic is really important to us within birth fit.
So within birth fit, so what the first pillar was? Say it again.
Nutrition, our mindset. Actually,
Mindset. So tell me what that means.
It means basically, where are you with this? Was this a wanted pregnancy? Was this something that maybe there's been some miscarriages before? Is there some trauma connected? What are you looking to get? Are you in a place where this is 100% where you're going,
And do they know how to answer that question?
Sometimes no.
Right.
Sometimes,
I would think, if you asked me in my pregnancy, and you also work with non-pregnant.
Absolutely.
So you would work with me.
Yeah, absolutely.
Because apparently I thought I had no diastasis recti, right? I thought my abdominal muscles came together fine. But there's some question about how we've been checking, and so we're going to do some investigating, Nikki and I, about how to check for a diastasis. So there's a potential that I have a 3 finger breath diastasis from fairly high down to almost my pubic bone, which is, that's really significant.
Yeah.
And my ego is a little bit bruised by the concept that might be true, but it was really interesting. We were checking today, and we were learning how to check in a different way. So if I were to go to you and you would ask me what your first question would be, what? If I come to you and say, Nikki, I don't know what's going on, but I don't have a 6-pack, and I really want, I don't know. I'm not concerned about losing weight, gaining weight. I'm really healthy. I hike, fairly frequently. I do hot yoga when I'm not broken.
Yeah.
And I'm fit. So I just want to, as I'm going to be 53. I'm older. I want to stay really fit. How can you help me?
So I think the things that I would ask you directly is, just like what you said, what your goals are, what you're trying to do. And then going into it, I would ask you, hey, do you pee your pants?
I don't.
See?
And if I did, I wouldn't tell you. Just saying. But I don't.
And what I mean by that is active. So when you're sneezing or jumping,
I don't.
Or do we have a hard controlling the urine stream? Is that a thing?
And that's very common.
Yeah. So those would be really right out of the gate questions.
What's your pelvic floor integrity like? And so you're going to ask very specific questions.
Yeah.
And that's a question you're going to ask someone in the beginning of their pregnancy, and you're going to ask someone 6 weeks postpartum as well, no matter the age.
Yeah, absolutely. Because these are questions that kind of have been taboo, and not everybody is asked for so long. And my goodness, I believe my son is 20 now, and I believe, highly.
We have kids the same age.
Yes. Isn't that cool?
She started really, really, really
I was a young mom. Yeah. I was 20 when I had him. But, so that makes me, 40.
Yeah.
But that's okay. I believe that I was living with pelvic floor dysfunction for probably about 17 years. It's only been through the functional progressions that we teach within birth fit, and that's really being conscious of that I've been able to even
So you didn't really even do any recovery work for yourself until 17 years.
Yeah.
So that's a question that comes up is it too late for me? When should I start doing this? And it sounds like
postpartum's forever.
Postpartum is forever.
Forever and ever. I'm 20 years postpartum.
I think today I might be having some postpartum depression. Can I blame it on
Yes.
Or anxiety, postpartum anxiety.
Mine was yesterday, so.
So we are always postpartum.
Yeah.
Correct. I guess
always.
That's true.
Always.
So,
and that's why you hear a lot of people get your body back, your pre-baby body back.
You can never get your pre-baby body back because that was your pre-baby.
Yeah, and
our bodies change.
We're created to create.
And our bodies change. It's like I would like my 18-year-old body
5 again. Yeah.
Or like have that body back whether I have babies or not, and that's just not the progression of our bodies.
Yeah, and it's not the way that we're intended to be, and it's not the mindset that we want to live with. So that's a big thing that I'm really trying to help women connect with, and just it's not a thing.
Right. And so how much work? So we have busy families, right?
Yeah.
We have people that are having babies that have, we just had a mom that leaves that has 3 babies and she works. And so the likelihood that she's going to be able to get to the gym,
right,
and financially be able to swing it, time-wise be able to swing it, because we can barely like get up in the morning and even finish a cup of coffee, right? So you get up in the morning, you make a cup of coffee. I mean, Kelly, when was the last time you were able to like get up? You're pretty good. Kelly's our social media person.
Hi.
In the background.
Hello.
You're pretty good because you have a real good, a lot of families do have a really good structure to their day. And a lot of moms are like, look, I'm going to get to my Pilates class. I'm going to get to my yoga
Yeah,
class.
mine is very structured. It has to be though because I run my own business.
right.
So
So
everything
but
is
that's-
structured.
So structure for some is
different.
really, it's different and it's available. But then we have other moms that are like, I get up in the morning, I'm just trying to make sure my kids don't kill me and that they're
Have a
not
day.
dead by the end of the day,
Yeah.
right? So how can you help them?
So I love that. I'm so glad you asked that because my goodness, I just have to tell you that is 99% of the women that I work with.
Because they don't even want to start because they're like, forget it, I can't afford it. I don't have the time to do it.
They have
My kids are already overwhelmed. I can't add this, and I know that I need to do it. And I'm peeing when I'm playing with my kids on the trampoline. I'm right. It's like I can't jump on the trampoline with the kids, and I really want to play with them, but my back hurts too much, and all these things. So
all these things, And as moms, I think we just put ourselves second, third, fourth, fifth, and the thing that I always try to teach is I'm really big on, just like you are, and the empowerment piece of what we do. I want what I teach women for them to be, I teach them to be able to do it in their living room.
right,
Wherever it's available.
right.
So we teach the functional progressions within birth bay, which are 4 movements that basically are stabilization. It's working with the DNS, which is dynamic neuromuscular stabilization in big words.
Dynamic,
muscular
muscular
stabilization.
stabilization.
So we're teaching the pelvic
How
floor,
to stabilize
the
your big
core.
muscles.
Yeah, and the little ones too, and how to actually breathe through it and have major intention on that. And this, everybody has a pelvic floor, so this is highly, highly, highly valuable to anybody. So my husband has a 6-pack on a 6-pack on a 6-pack. It makes me sick, by the way, because he can do whatever he wants. But anyways,
I think that testosterone might have something to do with
he has a pelvic floor. So what I teach and through to my pre and post, he does it too because he knows the value of it and the way that it sets up the core. So anyways, those principles can be taught and then taken on with them and taken to at home, in between a diaper change, in between, picking up in school. I tell my moms, this is absolutely your time. Set aside. I teach people how to do it for just basically about 20 minutes. Take 20 minutes of your day to do this. And then the technique that comes behind that is kind of what you make of it. So if whatever you're doing, yoga, functional fitness, Pilates, anything like that, just hiking, if you can set up your day with this intention to do these functional progressions, you are going to set such an intention throughout any type of training that you do,
Right.
that it's lifelong.
So what are the consequences in pregnancy when you see women start? So you can probably compare, I guess my question is, so if you have a pregnant person that starts in the first trimester with you versus someone who starts in the 3rd trimester with you, tell me what the benefit that first trimester person, I guess my question is, how much more, what's the goal at the end of this pregnancy for her? Like, what are you hoping, what is that pelvic floor going to do? Do you have enough time throughout the pregnancy? If you start later in the pregnancy, see what I'm getting at?
Yeah.
Like, is that enough time to have an effect? What kind of effect are we hoping for?
Yeah.
See what I'm saying?
So the best part of when I say the earlier the better, the same in your world, because from the second that you get your hands, I say my hands on a mom, to set up that intention and be able to say what I want, set up a goal, set up a birth plan, making sure that when they're training, they are not training inside a compensation, because in pregnancy, whatever is trained in anything in life, whenever you're training outside of function, so your body's not maybe moving correctly right, it's got some little twitch, get up, things like that, because you're training outside of a function and you're training now in compensation.
Okay.
That's going to transfer over.
Yeah.
So the sooner that I can have my hands on that and I can have visualization of what's going on, and each mom is different. So, you know, when we talk about the DRA and all that kind of stuff, diastasis, it can be present sooner in some women and later or not at all.
Are you paying attention to the diastasis in pregnancy?
Absolutely. Absolutely. Yeah. So right away, we're going to be removing any type of flexion extension. No sit-ups. We don't need to be doing sit-ups when we're pregnant. So
no sit-ups when you're pregnant, right?
And toes to bar, things like that where you're hanging and like that's it. I know it's a crazy word for you, but like gymnastics movements where we're working an extreme trunk flexion and extension. There's no purpose.
Right, we're not doing that.
We're not doing that.
Okay.
Yeah. So I can immediately eliminate that and teach these women what we use in place of those movements.
You're eliminating those because
it's outside
going to create
dysfunction.
Right.
So we're not training in that function.
So right, and we're really big at that when we're talking about prenatally exercises to do. We say like don't do any, and I don't know that I'm saying the right thing perhaps, but I say no core work.
Oh yeah, no,
crunches, no whatever you just said about trunk to knee,
your extension and flexion and all that kind of stuff. Yeah.
So we say no crunches because pregnancy is a time to be soft and parallel, and we want those abdominal muscles, and correct me if I'm wrong, to separate gently because the uterus is going to win, right, in that growth as the uterus is growing, and it's stronger than the abdominal muscles. So we want those abdominal muscles to naturally separate so the uterine muscle can get bigger without tearing. Is that correct?
Absolutely.
Okay.
Right on the money.
So tell me about some results. Like, tell me, have you had women have a baby and then come to you for the next one? And tell me what they say. I'm just curious what kind of things you're seeing. Yeah.
I'm seeing incredible things. It's really cool. It's literally in front of my eyes daily right now. So right now I'm working with 3 different moms that I had throughout their entire pregnancy.
I think you're not sure, but one of our moms sees you, but I don't know if she sees you regularly.
Yeah, so yes, I do see her, but not regularly.
Yeah.
She's super healthy, super intentional.
Emotionally, she's in such a great place.
She's amazing. She's great. And she is very familiar with the style of training that I'm really well versed in. So it's very easy for me to watch a video of her, to shoot dialogue back and forth, to be able to text message. So I'll see her probably 2 or 3 more times, and she's been amazing. She's a great client in that sense. But right now I'm working with 3 women, all post worked with me prior, almost all the way. Yeah. And now we are about within that 8 to 12 week marker for all of them.
Postpartum.
And what I'm noticing with them is their return has been.
So they're back to their return back to pre-pregnancy
ish. So it's a progression.
Right,
so
right.
I call it's like a ladder. So and with what we believe in within the birth fit model that I'm certified in is slow is fast.
Okay.
So the return and our function and the way that we move, the slower to get there faster. That's the goal. But what I'm really seeing is the way that the body is when we're not training in compensation. So during that pregnancy, eliminating certain things that may have transferred over falsely, they're coming back beautifully.
Wow.
So it's like this whole circle that's kind of completing and falling back right into place and to where. And what I love is the way my moms are feeling. They're feeling very in control. They're feeling very. They feel good about it.
The emotional component of setting aside time for yourself, even if it's 20 minutes a day, moving your body in a way that is positive and feels like you're helping your body recover. It's so very important for your emotional well-being, right? It's not about the shape of the body, right? We want to be really clear. It's not about, oh, I'm skinny, oh, I'm not skinny, oh, I have a six-pack, I don't have a six-pack. It's not about what other people are seeing. It's about what you are feeling that makes you feel better in your day and helps you cope better. Often as a mother, we have more tolerance. We're not as on edge, and we're eating better. It just is a self-perpetuating cycle where we want to do better more and more.
Yeah, absolutely. And it just kind of, it's a whole, that's the way that it hormonally too,
Yeah.
we're in control things a little bit differently. I'm super blessed to have a space where the women can bring their babies with them to train. So,
Which is really great, because a big problem in our post-recovery is that if you do belong to a gym, many of those gyms can't even you don't want to put your kid in the childcare until they're like,
right.
I mean, a few months old.
Yeah.
But certainly not at 6 weeks, 8 weeks, 12 weeks,
Right.
even 6 months. Often women are really uncomfortable bringing their babies to a situation like that. So being able at your gym to be able to bring them that's kind of amazing.
It's really special. Yeah, it's really special. It's a gift. I mean, for me, it's a gift.
Wow.
And for these women, it's something that it's become the culture inside the training club. So you'll hear people say, "You have a baby in the gym," and
That's okay. No,
he could play in there.
yeah, you can go play, and you could go in there. We'll be right in there.
So you'll hear that a lot.
That's okay.
It's on camera now.
Do you want to show me that guy? We have a mom coming in for her 6-week postpartum right now. Oh, that purple guy is super duper.
See, the baby came.
He's nice.
Last time I saw you, you were like, this baby.
We're talking about postpartum recovery is actually what we're doing.
I actually got to work with her a little bit, last week. Yeah.
Wow.
Awesome. Yeah.
Awesome. So one of our 6-week moms just walked in, and that's coincidence. That's awesome.
That's right.
So we were just saying, being able to bring the kids.
Yeah, it's
amazing.
It really is. And at first, I didn't know kind of what that was going to look like. Our culture's smaller, so we don't have huge class settings, and so it's studio training. So at first it was very, very okay, what is this going to look like? A lot of my training is one-on-one training. Sometimes that's just what mom feels comfortable with, but what I'm learning is because of that culture, because it's starting to feel so just real and it's organically. So now this morning, yesterday we had 2 babies, one 8-week, one 12-week, and then I had a 31-week pregnant woman, all in one class in a regular class setting.
And how nice for the pregnant person to be able to see the postpartum person and sort of chat about it. It's another way to connect to the community.
Absolutely. They're very connected. Part of it. Yeah, absolutely. That's the culture that we're setting here. And that's why it's so important for all of us just to be informed and just to kind of be able to support. Moms, we need support.
We need information, not what we should be doing. You should look like this. You should be eating that. You should feel a certain way. More than how are you doing and what can we do for you and what can we do together, and meeting people where they're at.
Absolutely. You just said it. That's exactly what it is.
Meet people where they're at. So some people might come in and they're like super awesome and they're eating really clean and they're super fit, and then the other person is just starting from scratch. But they should still be able to support one another and give that information to each other and be supported in wherever they're at. So
that's been incredible to see that.
So this work is really important. That pelvic floor work, that integrity of the body is important. It's going to affect how you birth. It's going to affect how you recover. It's going to affect you into your older age. So in your 50s, in your 60s, right?
Oh yeah.
So
I believe I was
to pay attention.
I believe I was training for years in extreme dysfunction.
I think I might need to start training.
Yeah, I believe I was. I really do, and I just can feel so much more in control of my body, and I'm like, where was this 20 years ago?
Awesome.
But now that we have it.
Right.
And it's just forward motion. Lead from the front.
Right.
Yeah.
That's awesome. So Miss Nicki is here, and I know that you teach, so you're at the training club.
Yes.
You also do stuff at Lulu.
Yes. Right? I'm a community educator for Lululemon, which I just love them. They're so amazing. They're so supportive. Yeah. They are,
They have the best pants on.
Best pants. But just the support of the community too, and they're really, really, really standing by my role and what I do, and they really are for us.
Awesome.
And they want to see this birthing, motherhood transition community just come alive.
Right.
And, you know, we're going to be doing that event coming up.
Yeah, we're doing an event.
June 2nd.
June 2nd at the Valencia Lululemon.
It's going to be at 8 a.m. We are working on if this is going to be an RSVP'd event or not, just because of how special and unique it's going to be, with some of the educators that we're going to have on staff and talking that day.
So I'll be there talking. You're going to be there talking.
Yeah, I believe Dr. Herrera,
our chiropractor, will be there talking.
and I'm going to be reaching out to the pelvic floor specialist
And some pelvic floor. Great.
Yep.
So it's going to be this event at Valencia Lululemon. And so in order to attend this thing, where would they go to get the information?
So we'll have it,
post something.
Yeah, and we'll have
on
it in
our
store.
Facebook page.
You can follow our Instagram, which is going to be the Training Club or Babe Fit SoCal.
And we could add those links to the
Yeah.
bottom of this.
And those will I'll always be posting on those to make sure the information is linked on there. Follow the Lululemon Valencia Facebook page; they'll post the
great.
event.
Will it be a free event?
Yes.
But it'll be an RSVP because
Yes.
it's going to be limited
And
space.
it's going to be special. So
Okay.
it's going to be where we're going to really want it to be a very unique environment.
Great.
Yeah.
Thank you so much for
Thank
coming
you.
over and doing this, and we really appreciate it. You're doing awesome work.
Yeah.
So thanks
Thanks for
everyone.
having
Of course,
us.
email us. Give us a call if you have any questions or concerns. Follow us on our Instagram, SCV Birth Center. And we'll see you June 2nd at Lululemon, maybe.
Yes.
Okay. Bye.
Bye.